What's up, everyone? Welcome back to Rally Pharma, World's Best Doctors channel. I know you know that, yeah? So we are continuing with our series of careers in pharmacy. And guys, sorry for the 2-week break, adulting. Anyway, yeah? So today we are back again with another doctor. And guys, please let us welcome him. You know how we do it. Let's do drum rolls. Yeah, thank you. So he's going to introduce himself, then I'll introduce the topic of the day. Yeah, so welcome, Dr. You kindly introduce yourself.
I'm Lawrence Njane, so that's my name.
Yeah, so he's Dr. Lawrence Njane. He's a pharmacist and he's a medical representative. So today we're going to look at a career in pharmacy as a medical representative. Yeah, so this is a career that a pharmacist can actually do, and he'll take us through that. So who is a medical representative?
So pharmacy practice is a very broad course. It's a very broad practice. So long as there is a pharma product or a medicine being mentioned, a pharmacist is not far off. So from research to sale of the product. So as a medical representative, we work in sales and marketing department of a pharmaceutical company. So this is why now we make sure that it's a commercialization aspect of the pharmaceutical products or the medicines. So those people who are in charge of marketing the products, making them known, through various methods. That is what is called medical representative. So medical representative specifically now, you work with an organization, a pharma company, for instance, and then you're the one who is in charge of making sure that their drugs, specifically by brand, they are known by respective users. Yeah, so respective users meaning that maybe it could be doctors' cadres, their products which are used by dentists. So we have medical representatives who go and see dentists and tell them about those products. Yeah, if it's maybe it's an oncology product, so medical representative who work for a pharma organization that manufacture or sell those oncology products, they go and see the oncologist and tell them about those particular products by brand and by molecule. So as a pharmacist, because we have been talking about drugs, so I think it suits best and more convenient to do such kind of an activity.
Okay, yeah, so briefly you've discussed what a medical representative does, and now let us look at it deeper. So how is your day-to-day, like what are your roles and responsibilities? Yeah, so that if someone out there wants to be a medical representative, they can know like what they are getting themselves into. So now, what does a medical representative do on a day-to-day basis? Tell us basically about your day in life as a medical representative.
Yes, so as it is perceived, I say the department is marketing, sales and marketing department. So the biggest objective here is to make the brand known, and that one can be measured now by generation of sales revenue.
Yeah.
So we can say it's basically a sales job.
Okay.
On one side. So on a day-to-day, so for example, if you're working with an organization, you of course you map. For example, let me give an example like in Kenya. You identify the product which you are detailing or dealing with or marketing, so to speak, and then you identify this product. Is it a hospital-based product? Is it an outpatient-based product? And which card are you targeting? Or is it an OTC product? And then now you come up with a plan. So depending on the kind of nature of the product, for example, if it's let us say for example the product is for dentists. So and if you work in Nairobi, for example, you map the region. You say Nairobi can be divided into 2 or 3 regions. The dentists are located here and there, and then you come up with a schedule, a plan on how to see each dentist. Maybe you book an appointment, and then when you get the appointment, you go and tell the dentist about the product. Insist, on why that product over others. And then if the dentist gonna agree with you, or like gonna like your product, or they like you, they prescribe the product to their patient, and that's how maybe now you make the sales. So that's how you make the difference.
Okay.
So you see, as a pharmacist now it becomes very easy for you, because you just need to get that connection between you and the primary user, who is the prescriber, that is.
Okay. Yeah, so briefly, it's just basically about telling doctors about your product.
Yes.
And then seeking their support.
True.
Yeah, okay. So now, in your day-to-day life, I know there are very many challenges that you face. So as a medical representative, could you just tell us what challenges you face and how you actually overcome them.
Yeah. So first of all, I can say there are no extraordinary challenges, they're just normal ones. For example, recently we have had COVID, and there was now, the face-to-face contact was not there. And if your job is to go and see a doctor, maybe in their chamber in a hospital, you see there was a limitation, so there was minimized interaction between the medical representative and the doctors. So it was, that was challenging, but it's that kind of challenge, it's a close or go there to everyone. So that challenge you might face, you might book an appointment with a doctor, and then maybe the doctor turn out to be very busy that day. So that time does not materialize. So that is one challenge. The other challenge is that I think there is significant amount of pressure before you master the art of sale, on how maybe to make sure that we usually have what we call key performance indicators. So for you to see that your plan and your strategies, they materialized to what you intended. So it takes some significant amount of time. The other time there are some people can look down upon you on what you know, and they might treat you with contempt.
With contempt.
So which is a very big challenge. But ordinarily, I would say there is no extraordinary challenge. I think it's just normal challenge like other sales job challenge. Yes, but I think pharmacists, if not many pharmacists who are like primary medical representative, I think if there are more pharmacists there, maybe the challenge will be quite minimal.
Less.
Yes.
Yeah, it's true. And then now you've talked about like becoming a medical representative. So how does someone actually become a medical representative? Like, is there any special training, or is there any course that you take for you to be a medical representative? You can just tell us, so that if there's someone out there who wants to be a medical representative, then they can know which route to take.
So so I think if you look even at most companies, when they're looking for medical representative or pharmacy representative or people to help them in sales and marketing, they usually prefer people with some medical background. And you see most medical representatives in Kenya, for instance, they have some kind of medical background. So either biochemistry, they have some small medical knowledge. So, but right now you see even most pharmacy companies, they say if you have a diploma in pharmacy and bachelor degrees in pharmacy, you are basically qualified to become a medical representative. On the job itself, of course you are trained, because there are those aspects of say that you don't know. Maybe you need to be trained how to do planning, maybe to be taught how each company have different style of working, so you are introduced how to do it, maybe you are oriented. So but I would say that if you are a pharmacist and you went to pharm school and you finished, I think you already have the the basic knowledge of a medical. You just need small amount of training that one is given in-house by respective pharmaceutical companies.
No extra course or something like I can learn online for me to be a sales or marketing person?
Not necessarily. I would say that, for example, there is no undergraduate degree for medical research. But I would say, okay, basic training is good, because you need some people's skills. You need to interact with people. You know how to communicate. If you don't know how to communicate, maybe you can work on your communication skills. Planning skills, those kind of things. Maybe if they are training like those ones, somebody can do those training so that they become better. So. But there is no one basic course that you go to learn how to become a medical representative.
Okay. So I just wanted to ask about like job opportunities. Are there sufficient job opportunities for pharmacists in this field? And if there are like sufficient opportunities, how actually does someone how does someone get to join a pharmaceutical company in the medical representative position? Because as we know, there are so many pharmacists outside there who don't have jobs.
So there are adequate opportunities for pharmacists to become medical representative. Right now, if you look at most pharmaceutical companies, they will advertise and say they want somebody with a medical background. So they may not specify categorically they need a pharmacist, but if you have a medical background, you are at a competitive edge, for you to do medical rep. So I would say there are a lot of opportunities, and if there is any pharmacist there who want to start and join a pharmaceutical company as their medical representative, I think they just have to keep watch, and also maybe tell those who are finishing school or they're in school, you can tell them that there is that traditional thinking that you can only work in the hospital, a community pharmacy or an industry. There is more than that. You can do regulatory. You can do research and marketing. Sales and marketing. You can do research. So, and I think the bulk of opportunity falls at sales and marketing, because we have many products being manufactured, being made, and they need to be sold, or they need to be known by the users, and that's where the medical representative come in. Yeah. So I think there is more than enough opportunities for the pharmacists who want to become medical representatives. So if you want to join, you just identify pharmaceutical company which you want to work with, either manufacturing or an external one, but they sell the product here, and they express your interest.
It's
and
true.
then you go for the interview. You start, and then that is it.
Yeah, because I remember at some point people, like in our time, people were actually working at into different pharmaceutical industries and just dropping their CVs. So you can still do that if you're jobless. I think that could actually also help you. And now, from a medical representative, is there a way in which maybe someone can rise, or once a medical representative, always a medical representative? Is there like room for going to a higher hierarchy in the same pharmaceutical industry?
Yes. There is much more room. For example, if you become a medical representative for in the first few months, you learn how the job is done. You can identify a gap. For example, you can become the trainer. You can train other medical representatives, maybe who don't have pharmacy background. You can be the person who comes up with the presentation, maybe when you're doing CMEs,
CMEs,
or when you're having discussion with doctors association. You can also identify a gap and say that we have this product. You can also add this product. You can become a manager. You can also, and then you can now, you have a pharmacy background and you are in sales and marketing department. It becomes much more easy to connect with other teams, like those who are doing regulatory, pharmacovigilance in the same institution. So it's so there is a lot of opportunity. There is no stagnation actually in this field. Because the products, either you get more products, so you become either you're in charge of them, you're managing them, or you train, or you identify a gap, and actually even suggest maybe to a pharma company, or because as a trained pharmacist, it's very easy.
It's easy.
You can say, we need this combination of this molecule, and you can brand it this way. So I think there is a lot of opportunity. Yes, and there is a high chance of growth.
Okay, so now the future of pharmacists in the medical representative or in the sales and marketing area, is it bright, or is it something that someone will just do and then they stop at that?
The future of pharmacists in medical representative is bright, and somebody can look at it in terms of sales and marketing of the pharmaceutical product, not entirely, maybe not exclusive as medical representative, and say there are very many opportunities, because if you check and see, traditionally not many pharmacies are there. So those who are there, they went there and made it, so it became a business venture for them, and then maybe now they are no longer medical representative. And if you check, like in Kenya, for example, some of the biggest pharmaceutical companies and the biggest distributors, those pharmacists who are there, they were one time a medical representative. Yes, so you would go there and learn the art of maybe doing business, pharma business, in a large scale, but you have to start, from a small scale, not really a small scale, I would say, but you have to start as a medical representative. Maybe you get a perspective of how pharmaceutical, sector works. Now in a more conceptual mindset than what somebody might perceive. So I would say that there is a lot of opportunities for pharmacists. Somebody just need to go there and maybe humble yourself a little bit and allow to be taught and start small. And now, when you combine all the expertise of pharmacists, which you have learned, and now you add small skills here and there of sales, I think there is very huge opportunity, and there is a big gap for pharmacists, because most people are not pharmacists who are doing medical representative, and they are doing well. So if we have more pharmacists there, maybe we'll have more and better impact. Yes,
it's true. So now, as we come to the end of the video, a parting shot to anyone who wants to become a medical representative or wants to venture into the field of sales and marketing in terms of the pharma, what advice can you give them?
So first of all, I can tell we are ready to support them. Those pharmacists who are there already, they are able to tell those pharmacists maybe who have no experience or don't understand how it is. We are ready to tell them how it goes. Maybe support them, mentor them, and maybe they gain more confidence. But I tell them that anybody who wants to join the sales and marketing in pharma industry, they are much more welcome, and there is a lot of opportunity. So that's what I say. So I don't think there is any need for any pharmacist to say there and say there is no opportunity. So just know, you come, people might not call him necessarily pharmacist because the job description is not for pharmacists traditionally, but you are a pharmacist, you have the expertise, so you're in sales and market department of the products, and it's so easy for you. So I will encourage everyone to join.
Okay. Okay, yeah. So guys, you know, I always tell you, I bring you people who will have an impact on you. You see, now if you want to become a medical representative or join the sales and marketing, he's out here and he's really ready to share the information. So if you want, always leave your questions in the comment section. Both of us will be able to respond. Also, if you have any issue with regards to or any concern about this field as a pharmacist, just let it down in the comment section. I'll also be able to respond. And finally, guys, take 5 seconds and subscribe. I know it goes all the way into supporting me. So thank you for subscribing. Kindly just 5 seconds and subscribe and share, because I know there's people out there who's gonna benefit from this. So thank you so much. Thank you so much for Dr. Ali for coming.
Welcome.
Yes, and guys, thank you so much. I'll see you on my next video. Bye bye.